I'm also a chiropractor here at Oxford Chiropractic. I have this stethoscope around my neck to remind myself to tell you a little bit about chiropractors. So we are doctors given the ability to diagnose. We're not treating cancers or kidney infections, but we're expected to differentially diagnose it from mechanical dysfunction. Now, the nervous system, the brain, and the spinal cord is all one piece of flesh. So just like this root system, imagine my fingers are the brain, and these roots are all the tributaries, that come off the spinal cord. You can see there's some debris. It's being soaked in this water, which is like cerebral spinal fluid that soaks our nervous system. Now, how does that pertain to chiropractic? Well, again, we're looking at the nervous system is encased in these spinal bones, and the brain is encased in the skull. So if there's tension due to abnormal movement or position of the spinal bones, it can cause tension along the nervous system, not only giving you pain or problems locally, but anywhere where that nerve travels. So this week at Oxford Chiropractic, I've taken out the seats in one of my treatment rooms and I've replaced it with the rebounder to illustrate a point that sitting is detrimental to your health. It's like the new smoking for many different reasons. A few reasons would be that when you're sitting, you're increasing the forces of gravity. So 50 times your body weight, 50 more pounds per square inch of pressure onto your discs and joint structures. Also, when you're sitting, you are not moving your joints. So if I move my finger here, I'm stimulating my brain. So your brain needs what we call afferent nerve stimulation to keep it active and growing. If not, it's degenerating. And the third component is when you're sitting, you're putting pressure up on the sacrum. So it's impeding this cerebral spinal fluid flow around the nervous system. So patients, while you're waiting for me this week, you can slip off your shoes and step up on the rebounder, the rebalancer, and I'll show you a few exercises that you can do. But if you see behind me, the Rebound Stability has many different benefits. It's an exercise, so it increases your cardio system and your max VO2, your respiration, just like exercise, but it's easier on your joints. It also increases your lymphatic circulation, so your lymph vessels, doesn't have a pump like your heart does with your vascular system. So you need skeletal muscle contraction to move around that lymph, which is part of your immune system. So it helps keep you healthy. Also, the skeletal muscle contraction or a weightless environment. So this gives you both. And NASA does a lot of research with the rebounder and trampolines because they train their astronauts, before and after a mission. And they found that this rebounder or rebalancing, the bouncing, is 2 times more effective than treadmill running. For increasing bone mass. Also balance and proprioception. So because you're on an unstable base, your body is having to make those little changes to improve your balance and coordination. And I'll show you a little bit about those with some exercises in just a second. It also calms your nervous system. It stimulates inner ear mechanisms that help balance sympathetic and parasympathetic nervous system. So if you have a colicky baby, what's the first thing you're going to do is bounce the baby. So it's calming, soothing, and finally the core strength. So let me pop over and show you a few quick exercises. So while you're waiting, patients who are watching this week, please try it out. Now you don't have to do anything crazy. You can just do a little bounce where you're bouncing on your toes, just lifting your heels, or you can run. You could lift your opposite arm and leg. You can spread out your opposite arm and leg. You can bring it in, bring your opposite arm and leg in and just do some cross-crawl type movements. Or again, just some little bounces. That'll warm you up for your treatment and also get a chance to try this. So I just purchased this at Amazon, rebounder, rebalancer, mini trampoline, but Kijiji, and there's all sorts of different ways you can purchase. So I thank you for watching. I'd invite you to look at our Facebook page. So Dr. Dina Churchill, Innovators Women's Health and Wellness, or Oxford Chiropractic. And we also have our Oxford Chiropractic website, oxfordchiro.ca. So thank you for watching. I'd invite you to reach for the stars, envision and achieve your personal best, and most of all, enjoy the journey. This is Dr. Dina Churchill signing out.